Good afternoon. I'm Eva Lathrop. I know so many of you on the call, but not all of you. I'm a founding board member of Konbit Sante, a longtime volunteer, and the current president of the Konbit Sante Board of Directors. And we thank you so much for taking time out of your weekend to participate in our presentation, The Power of Collaboration, Improving Pediatric Outcomes at the Justinien University Hospital. A couple of housekeeping things. We've all been on Zoom and other virtual platforms for the last many years, but always need a reminder. In order to preserve bandwidth, especially for our presenters and guests who are joining from Haiti, please keep your camera off unless you're speaking. So if you are the presenter, put your camera on. If you are asking a question or answering a question, we want to see you. Please put your camera on. We just can't see everybody at once. Please also be sure to keep your microphones muted throughout the presentation unless you're presenting or asking a question. And then if you have questions during the presentation, please put them in the chat. We won't take questions during presentations. We'll save them until the end. And if they're in the chat, we can address those via the chat. And then we'll also have time for hand raising and open question and answer. So welcome again. I think I'm scanning through the names of people who've been able to get on and along with the names of people who'd registered and gotten tickets for this event. And I know many of you, but not all of you. Many of you have been a part of Konbit Sante in one form or another, or in many forms since our inception. For others, Konbit Sante is relatively new, but we thank you all for your commitment and interest, no matter how long you've been with us. As we celebrate over 20 years plus of experience here and working together through many ups and downs, a friend of mine recently asked me, don't you get discouraged? How do you keep at it despite the enormous challenges? And by you, he didn't mean me, he meant all of us. And I responded that the short answer is yes, Haiti's experienced enormous challenges since we've been working all together in Haiti, and is experiencing an incredibly challenging time now. And so yes, we do get discouraged, but Konbit Sante's model has always been to walk side by side together, Haitian, American, all partners alike. And because of that, we have built authentic, shared experiences. We've built investments, relationships, and none of us is willing to abandon those. More simply, I think development partners, leaders, funders often leave Haiti after working with and for Haiti over a period of time. And in some of those cases, give up because of myriad reasons: fatigue, frustration, perceived or real danger, often donor pressure to achieve unrealistic results, or you could say ill-conceived results that are out of context. But we have always said that we are here for the long term to try to solve these intractable and sometimes perennial problems together, and to continue to call upon the resilience of this organization and all of us who are part of it to support this mission. And I think the stories that we'll hear today reflect this long-term commitment, the passion, and the resilience that is central to Konbit Sante. And so with that, I'll hand the microphone over to Tezita, our executive director, to introduce our presentations and our speakers. And I will follow my own instructions and turn myself off video and go on mute. Thank you. Over to you, Tezita.
Thank you, Eva. And thank you all for joining us today. My name is Tezita Negussie. I'm the country director and acting executive director of Konbit Sante. For those of you who are new to the organization and old friends of Konbit Sante who may not be familiar with the history of our partnership with Justinien University Hospital, I'm going to give a brief overview of Konbit Sante, our partners, and our work with Justinien's Pediatric Department before introducing our speakers today, Dr. Rony Fleur and Dr. Adam Silverman. So very briefly, Konbit Sante is a global health nonprofit organization that was established in Maine in 2001. Our work focuses on the northern department of Haiti, specifically the region in and around the city of Cap-Haitien. Konbit Sante is a capacity building organization, meaning that we support Haitian health institutions with the material, financial, and/or technical assistance that they need to offer quality healthcare. Our support runs the gamut from organizing trainings for residents at a university hospital, which you'll hear about shortly, to installing solar panels at a health center serving a semi-rural community on the outskirts of Cap-Haitien, to working with the administrator at a local hospital to develop a business plan that would ultimately save the hospital money on the purchase of basic medicines and supplies and low-cost options. Our 4 partner facilities, which include both government-run and private health centers, serve an area of nearly 1 million people. Our partners include Fort Saint Michel Hospital, a mid-sized public health center established in 2002. Fort Saint Michel has a birthing center, outpatient maternal and child health services, a TB clinic, and emergency services. Konbit Sante has partnered with Fort Saint Michel Hospital since 2004, focusing on community-based maternal and child health services. Unité de lutte pour la santé, ULS, is a small private health center providing clinical and public health services on the outskirts of Cap-Haitien in the neighborhood of Fort Choix. Konbit Sante helped design and fund the construction of the health center in 2012 and continues to support its operations. The Baptist Convention Hospital of Haiti, HCBH, is a 60-bed private hospital in Cap-Haitien near Cap-Haitien. We began our partnership with HCBH shortly after the earthquake in 2010, with Konbit Sante helping to build the Spinal Cord Rehabilitation Center on the grounds of the hospital. HCBH has grown to include maternity and pediatric units, a respite center for children with physical, mental, and special needs, and an emergency service. And finally, the focus of today's presentation is the Justinien University Hospital. JUH is a 300-bed public referral teaching hospital located in Cap-Haitien. The hospital provides advanced care in multiple specialties, including emergency medicine, internal medicine, obstetrics and gynecology, urology, orthopedics, among others, to a catchment area that covers 3 regions in northern Haiti. Our longest standing partnership with the Justinien has been with the pediatric department. It started with the service chief at the time, Dr. Sir Charles, reaching out and forming a partnership with Dr. Anne Lemire, a pediatrician from Portland and one of Konbit Sante's earliest volunteers. Dr. Charles and Dr. Lemire expanded the partnership to include pediatric nurses from Justinien and volunteer nurses from Maine Med, including Polly Larned, who's joined us today. From the beginning, the partnership has focused on quality improvement and using data to improve healthcare delivery and understand the factors that contribute to poor outcomes in the service. Data has been used to inform major infrastructure projects, support for medicine supplies and equipment, and training for pediatric residents, all of which Dr. St. Fleur and Dr. Silverman will discuss in greater detail during their presentations. Dr. Rony St. Fleur is a pediatrician and an attending at Justinien University Hospital. He's also Konbit Sante's program manager for pediatric care. He attended medical school at the State University in Port-au-Prince and completed his residency in pediatrics here at Justinien. Dr. St. Fleur is originally from St. Mark. Dr. Adam Silverman is a pediatrician and the director of the Center for Global Health at Connecticut Children's in Hartford, Connecticut. He's been a Konbit Sante volunteer since 2012 and joined the board of directors in 2019. St. Fleur?
Thank you, Tezita, for the introduction. As you already said, I am Rony St. Fleur. I'm a pediatrician and I'm part of the Konbit since 2008. Before that, I worked at Milo, a wealthy and private hospital in the north, run by American NGO from 2003 to 2008. I did my residency at GUH, and I also had the chance to do an observership in infectious disease, particularly HIV and TB in children at Jackson Memorial Hospital in Miami from July 2006 to January 2007. My training in Miami was my first experience outside the country as mentor and mentee. Dr. Gwendolyn Scott, my mentor, who was Paul Farmer's friend, understood the real nature of things in Haiti. She liked talking about the situation in Haiti and always asked what I could do for Haiti. And day after day, I understood that I had to involve myself more to make change in the country. She asked me why we have so Asian doctors working in the US, yet Haiti doesn't have enough good physicians to take care of the population. After discussion, it was like she gave me a mission. Konbit Sante offered me that possibility in 2008 when I met Nate Nickerson, the ex-Konbit Sante executive director. Once I knew the mission and the values shared by Konbit Sante, I understood he could help me accomplish my dream to influence my physician colleagues, particularly the younger generations, to be the game changers in Haiti. My talk this afternoon will be in 3 points. I will briefly tell you what a Konbit is, what is our approach at Konbit Sante, and the challenge we are facing in the hospital. Konbit is a term mainly used in the countryside. When a farmer has a field to cultivate and cannot afford to pay for laborers, he calls for a Konbit. The people in his neighborhood come with what they have and help how they can. Some bring their strength, their food, their voices as singers, and get the job done well and quickly. Next time, the farmer will do the same to help another farmer in need to cultivate his land, and so on. In our Konbit, JUH is the field, and we have the patients to care for. We have the local staff, physicians, nurses, residents, the US volunteers, the care staff, members of the JUH administration, and other NGOs in US as laborers. We work together with what we have as competency and power to improve care at JUH Hospital. What is our approach? Konbit Sante doesn't dictate the terms. It's there to first understand the problems, brainstorms with all parties involved to find the best approach to solve these problems with our available resources. Everything starts with the modality review, where staff in Haiti and staff in US sit together, identify where to intervene by studying the cause of each death. The diagnostic capacity of the staff means knowledge and skill. The structural issues will potentially be associated as cause of the death, for example, availability or not of oxygen, power, furniture, emergency drugs. After discussing and agreeing on the cause of the death, we try to see if this death could be prevented or not. If yes, we decide the action to take and give the responsibility to the person or the group who have the experience and the capacity to work with it. Each action is evaluated and we decide the next action to take, and the cycle starts again. As example, everyone agreed in 2012 that the mortality ratio was the main problem, but each of us saw several causes as an emergency. The building is not comfortable, the staff is not enough, no labs tests available, no meds, particularly emergency drugs available, staff unmotivated because they are underpaid, lack of power, lack of oxygen, water, machines and furniture not available as needed, and so on. Someone took note, and we started to classify them as priority first, then as feasibility. As we had a survey telling only 23% of kids receive their drugs as prescribed, we decided to work on it. It is true that there is not enough nurses, but also the nurses took too much time to document what they were doing. We decided to create a new sheet where they had only to check what they did instead of writing them. After 3 months, the percentage of kids who receive their drugs as prescribed grew from 23% to 73%. And that helped us decrease the mortality ratio also. Using this method, we have been able to have a new building from USAID, incubators, oxygen concentrators, CPAP machine, and recently a solar system where we are able to ameliorate power in the pediatric unit from 1 to 2 hours a day to 12 to 18 hours a day. That allowed us to warm our newborn babies in need, to provide respiratory support to premature and full-term babies, kids with respiratory distress. As we continue to sustain what we have been doing, we are working on a plan to improve the quality of training we give at the hospital, because knowledge and skills has been identified as a weakness. With the US volunteers, we are working on a curriculum for the training at the pediatric unit. Actually, we have an annual agenda where lectures for the entire year have been planned, what we didn't have before. And we just started with a research course for the staff so we can learn how to take decisions on evidence base. A lot has been done, but many challenges still remain. The political instability makes it difficult to sustain what we have been doing. It's difficult for us to have fuel to support the system, the solar system. Solar system problems makes it difficult to have electricity 24 hours, 7 days on 7. It's difficult to have emergency drugs on time because of roadblocks. More people become in need because of the political situation in the country. Even the local staff experience many difficulties to come to work daily and give care to the patients in need. Staff being in strike at least twice a year for several reasons. Almost all our incubators are non-functional for now. The need for emergency drugs are increasing day by day. More furniture are needed, and our staff is drastically decreasing, particularly the nurses. We need more than ever to continue with the Konbit. If not, the hospital could collapse. Haiti is not a lost case, but the situation is extremely difficult. With organizations like Konbit Sante, with people like you, we could achieve a lot. You are all welcome to join the great Konbit.
Thank you, Dr. Saber. Dr. Silverman.
Thanks, Tezita. As Tezita explained in her kind introduction, I'm a pediatrician from in Hartford, Connecticut, and I practice pediatric critical care and pediatric emergency medicine at Connecticut Children's Medical Center. I began volunteering in Haiti, providing bedside care to sick and injured children in Port-au-Prince after the earthquake in 2010. And I enjoyed the experience and continued to volunteer there. But after a few trips, I started to wonder if I could potentially be more effective if I was involved in capacity building endeavors, rather than simply providing clinical care while I was there. The work that I was doing I felt was important, but it was at a time that the healthcare system in Port-au-Prince was had been destroyed by the earthquake, and there was not enough physicians and nurses for these very, very sick and injured children. But as things started to stabilize, it felt that this really wasn't the best use of resources, of coming down for a week, of paying for airfare, and that potentially we could do something better. So I wanted to be involved in programs that emphasized collaboration and had long-term goals rather than really just brief interactions. And it was with this mindset that I was introduced to Konbit Sante. I've tried to remember exactly how I heard about the organization, and I still can't put it all together. But somehow I came across the organization, and I reached out to Nate and Tezita and asked if I could come to Cap-Haitien to better understand how the organization operated. When I first visited Justinien University Hospital in Cap-Haitien in 2012, I immediately realized that Dr. St. Fleur and Konbit Sante could be wonderful partners for collaboration. Konbit Sante had established a long-standing record of developing locally directed partnerships. You heard about many of them, and operating with an emphasis on sustainability and capacity building. So much of what I had been involved with before was really just sort of coming down and just providing direct care. But this seemed to be something different, and I wanted to know more. And this idea of a Konbit was something that was new to me. I'd heard about sort of barn raisings in the US, but this seemed even more robust. And so it was explained to me, and as you heard from Dr. St. Fleur, a group of like-minded or similarly goaled individuals come together to make an impact that is more significant than the sum of the parts. And this was exactly the type of effort I wanted to be involved in, the effort I wanted to participate in. And I also liked that this model was less about the desires or goals of the volunteers. The agenda is not determined by who wants to go, but really about the needs of the local healthcare providers and the need of the system in which they worked. So Konbit staff and volunteers would collaborate or are collaborators and facilitators who sort of help to position or find ways for local healthcare providers to achieve their goals, and that was something that I thought was the right direction to go with the efforts that I wanted to make. So I realized that this was going to be a different experience for me as a volunteer. I had gotten used to going down to Haiti and providing bedside care. But now I was going to be more of a content expert, a consultant, but it made sense to me. So now I was part of a process in which we were going to be looking at developing methods to strengthen the healthcare system, to empower Haitian doctors and nurses and facilitate their success if we could. And as I was joining the organization, it was right at this point where we were really starting to think about data, how we would collect data and how we would use data rather than an individual's opinion to drive the allocation of resources and determine where our goals were going to be. And it was also at a time where I was looking not just as an individual to get involved, but I was co-developing a Center for Global Health at Connecticut Children's, and there was a significant number of doctors and nurses who wanted to be involved. And again, this idea of a collaboration, of a Konbit, was something that a number of people at Connecticut Children's could participate in, and that was very exciting. So it was with sort of that background that I eagerly joined as a volunteer, Konbit Sante, and began this partnership with Dr. St. Fleur to see if we could work together to strengthen the healthcare system and provide better care for children in and around Cap-Haitien. So as you heard, one of the ways we do this is with our monthly mortality reviews. We essentially look at why children die at Justinien University Hospital in a very granular, data-driven manner. We use a spreadsheet. We have predetermined information to answer in the spreadsheet, some of it yes, no, some of it more descriptive, and use that to understand potential interventions that can decrease preventable causes of death. And so we look at these children and we review what happened and then try to look at how we can intervene to improve outcomes. This idea was relatively new in Haiti, And, it took some time for us to develop the tools, to agree on the different factors, and even just to get comfortable with the idea that we were going to talk about children that passed away. And that could potentially be troublesome. The hospital was wary, staff was somewhat wary, but we all agreed that this was really the best way in which we could find methodologies for improving care. Dr. St. Fleur mentioned a few examples of the ways in which we've intervened. One of the things that I recall is that as we started to look at the data, we quickly realized that we needed more expertise. Many of the children who pass away at Justinien, similar to other hospitals and resource-limited settings, are newborns. And, none of us were neonatologists. So again, rather than relying on whoever wanted to volunteer, we reached out to identify people who specifically were experts in neonatology. We actively recruited healthcare experts such as Dr. Vic Herson and Dr. Dan Sobel, who are neonatologists and have been practicing neonatology for quite a while, and could look at these newborns and identify preventable or areas that potentially, if changed, could decrease preventable causes of death. And from this review, one of the first things we realized was that there were not enough trained providers at newborn deliveries to resuscitate struggling neonates. Sometimes there wasn't even a pediatrician there. That was the first thing we realized, that there was no one responsible for the resuscitation of a newborn at deliveries at Justinien. Deliveries were performed by OBGYN residents, and there was often an intern there as well, but the interns had never been trained in resuscitation. And so we worked on, okay, how do we make sure that there was someone trained at deliveries who can help a struggling child? And we made changes in staffing assignments, but also had to do the training in neonatal resuscitation. So we brought down neonatal nurses, respiratory therapists, and held a number of courses on neonatal resuscitation. And once we felt that there were enough trained providers, then we trained local doctors to actually be trainers in neonatal resuscitation, to create a train the trainer model. And now we had a system where these children were being resuscitated appropriately at a much higher rate, and more babies were surviving. And that sort of led us to our next data-driven decision. We could see that children who are being resuscitated, or newborns who are being resuscitated and now surviving in a situation where previously they weren't, were having respiratory issues. And there was no great system for providing ongoing respiratory support for these newborns aside from supplemental oxygen. And they needed something called CPAP, continuous positive airway pressure. CPAP is something that's provided in the United States in a very high resource dependent methodology. But through our review of what was available, we realized that there were CPAP machines that could be used at hospitals such as Justinien that were robust and able to handle potential power surges, that the materials they used were cleanable and reusable. And so the respiratory department at Connecticut Children's purchased a number of these. Konbit Sante purchased a number of these. And again, we put together a team recruited specifically to provide training to doctors and nurses at Justinien in the use of CPAP and the support of children with respiratory distress, or newborns with respiratory distress. And so respiratory therapists and nurses and physicians came down to Justinien and provided a number of courses to improve the care of children, newborns, infants less than a year of age who had respiratory distress. And this continues to be used frequently in Haiti. And again, this was driven by our mortality reviews. And then again, as you heard Dr. St. Fleur said, then we started to realize, okay, now we are resuscitating these infants, these newborns, and they're surviving. Now we're supplying them with support for their breathing. But these CPAP machines, even though they're designed to be used in resource limited areas, they need electricity. And so what the data was telling us was that when electricity was interrupted at Justinien, children were dying, infants were dying. There's one diesel power plant which supplies electricity for the entire city of Cap-Haitien. This power is frequently disrupted, it's unreliable, there's power surges through the system. And so to introduce something like CPAP and then for multiple hours a day to have that interrupted was not sort of fulfilling the goals that we had put in place. And so once we identified that, Konbit Sante invested a significant amount of effort and resources in installing a solar power network in the newborn and pediatric wards so that now we could continue to provide this therapy even if electricity from the power plant was interrupted. Another thing that we realized was that this training that we were providing to the doctors and the nurses in resuscitation of newborns and also in the resuscitation of pediatric patients was really just part of their overall pediatric training in as residents. And as Dr. St. Fleur has mentioned, we realized that this was another opportunity, that there was a number of children who were dying because there was a lack of knowledge or lack of skills. If a pediatric resident hadn't seen a case of this disease process before, they wouldn't know how to care for these children. So we really looked at the curriculum that we were using, that was being used there to train the pediatric residents, and identified, the 50 most important things that a resident should know, and organized lectures in a way that we could make sure that even if a resident had not encountered this disease process before, or maybe they had but didn't understand the reasoning behind the treatment, that they would have a lecture or some sort of training session on these 50 different topics. And we divided up the different topics amongst volunteer attendings, local attendings, and even the residents themselves to work on educating each other and becoming experts in an increasing number of topics. We even had the opportunity to sort of discuss our work with the president of the International Accreditation Council for Graduate Medical Education, really looking at, how can we make the training program at Justinien really one of the top training programs in the country. There's only a handful of pediatric residency programs, and this is the one that supplies pediatricians for the entire north of the country. And so emphasizing and working on improving the education was going to be really important. We continue to this day every month to meet and review data and look at what can be done. And, it feels like this is really working. We've even been approached by other hospitals in the area who want to use the same methodology to start looking at why children die at their institutions and how to use the data and the information acquired to help them reduce their mortality rates and help to improve care. The last thing I wanted to mention as a volunteer and now as a member of the board of Konbit Sante is sort of this, why Haiti? By this, I mean the question that a number of other people have sort of mentioned is, why continue to work in Haiti where, or why people should invest time and money in a country that has been portrayed so negatively by the press and even by our government, and that some people would say is a lost cause. And for me, there's sort of three reasons. One is just sort of logistics. I mean, geographically, Haiti is so close to the United States. Cap-Haitien and Port-au-Prince are about an hour-and-a-half flight from Miami. It's a neighbor. And when you start to experience the incredible difference in wealth and luxury that's available just off, in Miami, and then see what is happening in Haiti, it's almost inhumane that these two places are so close to each other. And because of the close proximity, a major barrier to being involved is eliminated. We all know that there's lots of places, in the world that need our help. But this is a place where 24 hours of travel is not a barrier to participate. I can leave my house at 5:30 in the morning, take a couple of flights and be in be in Haiti by the afternoon, participating in a process. And that means something to me because I have limited time and time is a resource, but Haiti's close by and I can be involved very easily. The second reason is my feeling that the US government and other powerful institutions of the developed world have caused a significant amount of pain and suffering in Haiti. And that I, as a white educated man in America, have benefited from these policies that have directly devastated Haiti. And so my efforts in Haiti are a personal reparation for the harm caused. We benefit and Haiti suffers. And, not everybody always wants to hear that, but those are my beliefs. And the third reason is really the dedication of the doctors and nurses I've worked with in Haiti. Dr. St. Fleur is an amazing partner. I find, the fact that he, despite having other options and could be living an easier life, stays at Justinien and has dedicated his life to improving the care there and improving the education of pediatric residents. And this I find incredibly inspirational. It motivates me. I've been educated by this process, and it really has provided the direction for my professional and philanthropic work. And so I continue to want to be involved. And there's really almost nothing that I find more rewarding than working with Haitian healthcare providers and working with Dr. St. Fleur. So, thank you for being here today and allowing me to sort of share some of these thoughts.
Thank you, Adam. That was great. Thank you, Dr. St. Fleur. So we are going to open it up to a question and answer session now. So if you have any questions, please put it in the chat or raise your hands. Yeah. What questions do you have for Dr. St. Fleur or Dr. Silverman or me? Or we have the founders, Dr. Michael Taylor and Wendy Taylor on the call as well. So yeah, what are your thoughts about what you've heard today? Or I can start to get us going. I've got a question for Dr. St. Fleur, who just happens to be sitting right next to me at the moment. Let's see. So Dr. St. Fleur, you touched on this a bit earlier. You talked about the challenges that we're facing currently with the political situation in the country, the economic situation, which is also affecting the hospital. What are your thoughts about next steps in terms of improving quality of care for children at the hospital, community-based public health efforts for children and families? Yeah, what are your thoughts in terms of what could be done to address some of the challenges that you mentioned?
I think we are in a difficult situation where we cannot count on our government because they are at Port-au-Prince and maybe they don't know what really happened in the country. But as a physician, I am on the field and I feel the distress of the population. I feel the distress also of the staff who are devoted to take care of the patient and they don't have the meaning to give care. So I think we have to continue. We don't have to be discouraged. So hopefully we have partners we can count on as we are in a Konbit. So little help can help. I remember a Creole proverb used to share. Piti piti, so finish. Little by little, we can do a lot. So I think we have to continue to do the job. So even though the situation is difficult, so we have to continue. That the answer I can give to your question, Tezita.
All right, let's see. So I've got a few questions coming in. One is from Nick Pernetta, who's, I think you might know Nick. Nick works at Soil, a partner organization based here in Cap. Nick's question is, can you speak to whether staffing issues are impacting outcomes, or what are the barriers to consistent staffing?
Sometimes we have at least 60 to 50 inpatients. And we have 3 shifts. And at each shift, sometime in the morning, we have sometimes 3 to 4 nurses for all the patients. In the afternoon, we can have 1 or 2. And at night, sometimes we have 0 nurses. And, you know, it's very difficult to give care to a patient if we don't have nurses. And unfortunately, the government said they didn't have the meaning to hire more nurses. So mostly the resident and the intern we have to do the nurse's job. If not, kids with that will be dying. So even for a physician, for the attending, we have like for now 7 attending, but because they don't have the meaning to live with what the government pay them, they have to do other jobs, like having their own private practice or work in the hospital. So they don't have enough time to spend in the pediatric unit with the resident or with the patient. So that's difficult, very difficult to address, because I know it will be very difficult for an NGO or for the partners to pay for physicians or for nurses for a long time. That could be the government job. But as I said before, either they don't have the capacity, either the care of the population is not the priority yet. So it's a very challenging the situation, managing the staff in Justinien, particularly in the pediatric unit. It's very difficult.
Thank you, Dr. St. Fleur. Another question, this one from Dr. Michael Taylor. He wrote, there are other departments such as internal medicine and surgery at Justinien. Can you reach out to those departments to achieve the same improvements you've achieved in pediatrics?
And when I first met with Michael and Wendy at the hospital, their will would be to work with all the unit, but unfortunately, they couldn't find a champion for each unit. But I think they need to have someone to help, because that's the reason I think having like the research course to everyone, or having other activities to everyone, to let them know what we have as a result of the pediatric unit, and that could serve like a late material, I could say, like an example for them to understand they could do some change by themselves also if they want. But as I said before, the situation is the economic situation is very bad, because sometimes they can spend like 3 to 4 months without having paid. So they are not motivated enough to take care of others, because they can take care of themselves. So as I said, it's not a lost cause. It's not a lost cause, but we need to work on that so we can have others to join or to work as the pediatric unit work. But I think they need someone to show the light to them, because pediatric is not the reality at the pediatric unit, as the pediatric unit is not the same as this emergency or the surgery or internal medicine. At the pediatric unit, they have me and Dr. Toussaint as models, but in the other service, the residents are like by themselves. Even though they have attending, they don't have time for them. So that's a difficult situation, but I think that the pediatric unit has to do more to show them the result they have, to show them the model we use, so they can be part of the process also.
Thank you, Dr. St. Fleur. We have another question from Christophe de Lespenes. Sorry if I'm mispronouncing your last name. What resources are available for residents? What studying resources are available to residents? Is this question.
Okay. At the pediatric unit, for example, we have the US specialists like Dr. Silverman, Dr. Vic, Dr. Daniel, Dr. Michael, and Dr. Sabogal, who support us. We have the attending. We have the Konbit Sante office because they can come and use the internet we have to do research. We have lectures like at least twice a week for all of them, but we are trying to organize the curriculum for the training, but for the other service, I can say I can tell they have only the resident and their will to learn, and even though they have staff attending, they are not enough, and they don't have help from others either. Maybe they are not looking for that yet, but I know they need help from outside also to train the residents, and also to even to train the attending also, because it's not only the resident who need to be trained, but we also as attending, as trainers, we need to be trained also, because our system are not like the US system, where the attending have to have an update every 5 years or to have an exam. Once you have your diploma, you are not you don't have an obligation to be updated. So I think they need help from other specialists, for even though that could be, if it's from USA, that will be great, but I think they need help.
Well, I guess I just want to say we do need help with translation. So, Christoph, hopefully we have your contact information. There's been a number of different sort of projects that we've done where translating services, or at least reviewing things that we've translated using Google Translate as the starting point, could be really helpful. As you heard, one of the things that we've done to improve the residency training are objective measures of knowledge. So creating test questions based on pediatric board exams in the United States and having those translated into French was one of those activities. Sometimes when we do other types of training, we use material from the US and need to translate it. And we have a variety of different things, ways in which we do it. But if you're interested in helping, you may hear from us again, because that is something that we could use some help with.
Absolutely.
Yes.
I will follow up with Christophe. Thank you.
I'll send you my contact information, but
Yes,
Thank
please
you.
do. Thank you so much. Let's see, another question. This is from Dr. Yusleen Telemak. She wants to know how Konbit Sante support is perceived and what Konbit Sante means to Justinien.
Okay. At the Pediatric unit, the ex-chief of the Pediatric unit used to say, Konbit Sante is like a father for the Pediatric unit. It's because everything they need, they could ask Konbit Sante, and most of the time we receive them from Konbit Sante. So the Konbit Sante support is well perceived at the Pediatric unit, but sometimes people think Konbit Sante should do everything for them. They forget we are a public hospital that should be supported by the government. But we know Konbit Sante is a little NGOs. We don't have all the capacity to help, but the support is well perceived at the Pediatric unit. What Konbit Sante means to a GUH, I think the Konbit Sante means a lot for them, because Konbit Sante not only invest on training or materials, but Konbit Sante invest also to train the US administration how to manage well their resources they have. So I think, according to me, Konbit Sante means a lot for the hospital. But when I heard the others, I think Konbit Sante means a lot for them, even though they thought Konbit Sante could do or should do more for them. Because as they used to work with other NGOs who have a lot of meaning, they come and bring money and doesn't ask for result. So we need money, give us money, so we have to, so we can work. But Konbit Sante, the way they work with us. They try to identify why we can spend money to have better result, and also they ask for result also. So some people in Haiti doesn't like when you ask for result, but even though that, I think the community support is well perceived at Justinien Hospital.
Thank you, Dr. St. Fleur. So we have a few minutes left for this presentation. We're due to end at 2 o'clock. Any other questions or comments from anyone? Adam?
No, I think these are important questions that were asked. I think Erica's final comments about having a champion like Dr. St. Fleur are important. Again, Dr. St. Fleur has options, but he's decided to take on something very difficult. And I think it's really what has allowed us to be effective within pediatrics at Justinien. And I'm glad that others recognize how important he is as well.
And I want to acknowledge a note from Rhonda Vosmus, who traveled with us many years ago in 2009 and hasn't been able to travel since because of her son passing away. She's now taking care of her grandson, but she sent us or left a really lovely note about our work. And so thank you, Rhonda. We really appreciate it. Let's see. And Wendy wanted me to remind you that this recording will be available within a few days. And we'll let you know where you can find it. So, Eva, do you want to wrap this up? Unless there are any other questions or comments?
I'm happy to take it over, Tezita. Thank you, Adam. Thank you, Dr. St. Fleur. Thank you, Tezita, for moderating. It's so moving to hear all of this again. I thought I knew all of it, but I needed to hear it again and to hear some of these beautiful stories that really represent so many years of work and constant use of learnings to adapt approaches and adapt our implementation. And I think you both gave some examples of small changes that have made really big impact, and examples of how we've made observations, asked questions that nobody had been asking, collecting and using data to identify big problems and coming up with solutions for change. And we indeed, I think we're true to the title of the presentations. We heard about the power of collaboration and our long-term vision for lasting change. So thank you both, and thank all of you on the line for participating. Please continue to be a part of our Konbit in whatever way that you can. Enjoy the rest of your day, stay well, and please do keep in touch with us. Thanks again, everybody.